Have you ever had a strange feeling in your chest or a mild headache or some muscle pain, and suddenly you're convinced you have cancer or a strange disease? And then you do what most people do: Google it. Could you be struggling with health anxiety? Here are 7 signs you may have health anxiety and the mistake that keeps it getting worse. I'm Dr. Ayer, quadruple board certified psychiatrist. I've treated thousands of people struggling with anxiety, and health anxiety is one of the most misunderstood, most undertreated, and most isolating forms I see in my practice. Number 1, you Google your symptoms and it always leads somewhere terrifying. Dr. Google has never once reassured you. Not really. You might feel okay for 5 minutes, but then you find the next article and the spiral starts again. A nervous system in threat mode turns the brain into a constant searchlight, sweeping your body for danger, despite your actual safety. 99% of what you read is irrelevant, yet your brain locks onto the 1%, confirming the worst. Your nervous system is using the internet as a weapon against you. And here's the part that makes it worse. I'll come back to this in a minute. The more you search, the deeper the pattern gets wired in. Number 2, you seek reassurance constantly, but the relief never lasts. You call your doctor, ask your spouse, or post in a health forum. You feel better for a while, then it comes back, stronger than before. A patient, let's call her Sandra, called her doctor's office 3 times a week. She wasn't difficult, just terrified. Each assurance gave her brief relief. In her brain, reassurance triggered a brief dopamine release that eased fear. But the brain learned reassurance manages the anxiety, lowering the fear threshold and increasing the need for more reassurance. It's not weakness, it's a loop. Recognizing this is the first step to breaking free and restoring control. Health anxiety isn't just worry, it's a nervous system dysregulation pattern with 2 psychiatric diagnoses: illness anxiety disorder and somatic symptom disorder. Illness anxiety disorder is when you're consumed by fear of having a serious illness, even when your body isn't producing many physical symptoms. The fear itself is the problem. In somatic symptom disorder, you experience real physical symptoms, but your brain amplifies them beyond the underlying cause. One is more about the fear of the illness, the other is about real symptoms that the brain turns up full volume. Both are real, diagnosable, and rooted in a nervous system stuck in threat mode. Understanding this connection is the basis for effective help. Number 3, normal body sensations feel like emergencies. A skipped heartbeat, a twitch in your leg, a moment of lightheadedness when you stand up too fast. For most people, those are background noise. For someone with health anxiety, they are red alerts. This happens due to interoceptive hypersensitivity, meaning your nervous system is so sensitized it can't tell threats from neutral sensations. It's like a car alarm that goes off every time a truck passes. The alarm isn't faulty, it's just set too high. This is not you being dramatic. This is your threat detection system misfiring, and it's reversible. Number 4, you either avoid doctors or go constantly, sometimes both. Health anxiety doesn't always mean frequent doctor visits. It can also mean avoiding doctors out of fear of what they might find. Both patterns, constant reassurance seeking and complete avoidance, are the brain's attempt to manage unbearable uncertainty. The DSM-5, the Manual of Psychiatric Diagnosis, actually distinguishes between these 2 subtypes in illness anxiety disorder: care seeking and care avoidance. Different behaviors, same roots. A nervous system that cannot tolerate not knowing. Number 5, your anxiety spikes when someone close to you gets sick. A friend gets diagnosed with something serious. A family member ends up in the hospital, and suddenly your own body starts producing symptoms. This isn't a coincidence, and it's not hypochondria in the dismissive way people use that word. Your brain has a system that responds to perceived danger. When someone in your environment is sick or in danger, your nervous system activates your own threat circuitry, almost as a preemptive defense mechanism. For a regulated nervous system, this response is brief. For a dysregulated one, it can spiral for days. Sleep amplifies this pattern. Poor sleep makes your threat system more reactive. I'll come back to this in a moment. Number 6, you've had a full workup. everything came back normal and you still don't believe it. This is one of the most painful and isolating experiences health anxiety creates. You did everything right. You went to the doctor, you got the test, and the results came back clean. But instead of relief, you feel more anxious. Here's the thing though. Standard tests are great at detecting structural problems, but they don't measure nervous system dysregulation, cortisol rhythm, chronic inflammation, or the way your brain processes signals. The tests aren't lying, but they're not telling the whole story either. This is exactly where integrative psychiatry offers something different. It doesn't just ask, is something wrong, but also, why is your nervous system generating these experiences in the first place? Number 7. Health anxiety has started to shrink your life. You skip trips because something might happen. You stop exercising because your heart rate scares you. You cancel plans because fear makes the decisions. Now, fear makes your decisions. In the DSM-5, anxiety causing real functional impairments marks the line between worry and a diagnosable condition. This is what anxiety does if not identified and treated. Recognizing it is the key to reclaiming your life. Before we talk about treatment, it is essential to know that all 7 of these signs stem from the same root: a nervous system that learned to scan for danger and got stuck doing it. And that nervous system doesn't operate in isolation. It's been influenced by your sleep quality, your blood sugar stability, your inflammation levels, your cortisol rhythm throughout the day. For many adults over 40, hormonal shifts make this significantly worse. But the mechanism is the same at any age. The brain becomes a hypersensitive alarm system. The goal isn't to silence the alarm, but to recalibrate it so it responds appropriately. This is achievable. Having outlined the problem, let's focus on solutions. So what actually works? Pure reassurance seeking doesn't fix this. More testing without a treatment plan doesn't fix this. Telling yourself to stop worrying definitely doesn't fix this. What works is addressing your nervous system directly. This is the critical path to improvement. That means sleep. It means stabilizing blood sugar. It means reducing the inflammatory load on the brain. It means the right kind of therapy, specifically approaches that retrain the threat response rather than feeding it. It means micronutrient testing and supplementation with the right vitamins, minerals, and herbs. And sometimes it means medication used strategically, not as the only answer, but as one tool in a complete plan. One of the highest leverage starting points is your sleep. Poor sleep is like pouring fuel on an already overactive nervous system. It lowers your threat threshold, amplifies every sensation, and makes the reassurance loop nearly impossible to break. I put together a free sleep guide specifically for people dealing with anxiety. It's in the description. Download it, use it, share it.